A veterinary technician is asked to administer a controlled substance to a patient. Describe the steps required for compliance with legal and regulatory standards when handling controlled substances. What are the legal repercussions of failing to meet these requirements? Answer: veterinary technicians must follow strict guidelines when handling controlled substances to comply with federal and state regulations. The Controlled Substances Act (CSA) mandates that controlled substances be administered under the supervision of a licensed veterinarian and documented properly. Steps for compliance: authorization. Ensure the controlled substance is prescribed by a licensed veterinarian and verify the authenticity of the prescription. Secure storage. Controlled substances must be stored in a locked, secure cabinet, accessible only to authorized personnel. Documentation. Keep detailed records of every administration. This includes the date, time, patient name, drug name, dose, and the administering technician's signature. Inventory management. Regular inventory checks are required. Discrepancies between actual stock and recorded inventory must be investigated and reported. Disposal. Unused or expired substances must be disposed of according to federal guidelines, which often involve incineration or return to a licensed disposal service. Legal repercussions. Failure to adhere to these regulations may result in serious consequences, including fines, criminal charges, or loss of professional licenses. Violations of the Drug Enforcement Administration (D) regulations can lead to significant penalties under the Controlled Substances Act 21 U.S.C. SS 801 et seq. Furthermore, improper handling or mismanagement can jeopardize patient safety and lead to accusations of drug diversion, which can incur both legal and ethical repercussions for the veterinary clinic. Explain the difference between Schedule II and Schedule II controlled substances. Provide examples of drugs in each category and discuss how veterinary technicians should handle these differently in practice. Answer: controlled substances are classified into schedules based on their potential for abuse, medical use, and risk of dependence. Schedule II and Schedule II substances are both highly regulated, but they differ significantly in terms of handling and regulatory requirements. Schedule II definition. Schedule II drugs have a high potential for abuse, which may lead to severe psychological or physical dependence. However, they do have accepted medical uses under stringent controls. Examples: morphine, fentanyl, hydrocodone. Handling requirements. Schedule I substances must be stored in a secure, locked cabinet. Inventory must be meticulously documented, with each administration recorded in real time. Any discrepancies between recorded and actual stock must be immediately reported to the DEA and local authorities. Schedule through definition. Schedule I substances have a lower potential for abuse than Schedule II drugs with a moderate to low risk of dependence. They also have accepted medical uses. Examples: ketamine, buprenorphine. Handling requirements. While still stored in a secure area, the documentation and inventory reconciliation requirements for Schedule I substances are somewhat less stringent than those for Schedule II drugs. However, they still require careful record keeping and secure storage. Veterinary technicians are responsible for ensuring that both categories are handled per legal requirements, and failure to comply with the regulatory differences can result in severe penalties. Dr. Patel's clinic receives a report that a dog treated at the clinic recently tested positive for rabies. Claire, the veterinary technician, had handled the dog during its visit. Discuss the immediate actions Claire and the clinic should take to address this situation, ensuring compliance with public health regulations. Answer: when a rabies case is suspected or confirmed, immediate actions are crucial to prevent further exposure and comply with public health regulations. Immediate actions: notify authorities. Claire must report the positive rabies diagnosis to the local public health authority and animal control. Rabies is a reportable disease, and swift notification is required to protect public health. Exposure assessment. Claire should assess if she had direct exposure to the animal's saliva or nervous tissue. If she had direct contact, she should seek post-exposure prophylaxis (PEP) as recommended by the CDC. Quarantine and investigation. The clinic should quarantine the dog and any other animals that might have had contact with it. The authorities will need to trace other potential exposures. Documentation. Claire and other staff should document their interactions with the dog, including any risk of exposure. This documentation may be used in any follow-up investigations. Client education. The clinic should notify the pet's owner and any other clients who may have been in the clinic around the time of the exposure. Educational material should be provided on rabies transmission and prevention. The clinic must adhere to local, state, and federal rabies control regulations, such as the Rabies Control Act and CDC guidelines for rabies prevention. Describe the regulatory requirements for transporting animals internationally. Include details about health certificates, quarantine protocols, and the role of veterinary technicians in facilitating compliance. Answer: transporting animals across international borders is governed by several regulations designed to ensure both animal welfare and prevent the spread of diseases. Veterinary technicians play a crucial role in facilitating compliance. Regulatory requirements. Health certificates. Animals must have a valid health certificate issued by a licensed veterinarian accredited by the USDA. The certificate must confirm the animal is healthy and free of contagious diseases, including rabies. It should meet the specific requirements of the destination country. Vaccination records. The animal's vaccination status must be documented, particularly for diseases such as rabies. Many countries require proof of vaccination within a specific time frame before travel. Parasite treatments. Certain countries require evidence of treatments for ticks, tapeworms, or other parasites. Veterinary technicians ensure these treatments are properly administered and documented. Quarantine. Some countries, like Australia, may require animals to be quarantined upon arrival. Veterinary technicians should help arrange for quarantine, ensuring the animal's health and compliance with these protocols. Transport crates. The animal's transport crate must meet the International Air Transport Association (IATA) standards. Veterinary technicians verify that crates are appropriately sized, ventilated, and meet safety standards. Veterinary technicians must work closely with veterinarians to ensure all documents and health measures are in order, thus avoiding delays or non-compliance. Why is personal protective equipment (PPE) critical for veterinary technicians when handling zoonotic disease cases, and what are the consequences of inadequate use of PPE? Answer: personal protective equipment (PPE) is critical when handling zoonotic diseases because it acts as a barrier between the veterinary technician and infectious agents that can be transmitted from animals to humans. These diseases pose significant health risks, particularly in veterinary settings where exposure is common. Importance of PPE: prevents infection. PPE protects against direct contact with bodily fluids, tissues, and pathogens that cause diseases such as leptospirosis, brucellosis, or rabies. Complies with OSHA standards. The Occupational Safety and Health Administration (OSHA) mandates the use of PPE under the Bloodborne Pathogens Standard 29 CFR 1910.1030. Failure to comply with these regulations can result in workplace safety violations. Protects clients and the public. PPE use helps prevent the spread of zoonotic diseases to clients, the public, and other animals. Consequences of inadequate PPE: increased risk of disease transmission. Inadequate PPE increases the risk of direct exposure to zoonotic pathogens, leading to possible infections such as toxoplasmosis or Q fever. Regulatory violations. Non-compliance with PPE regulations can lead to legal consequences, including fines or citations from OSHA or local health authorities. Liability issues. Failure to protect oneself properly can lead to legal claims against the clinic or technician if clients or employees contract zoonotic diseases due to negligence. PPE, including gloves, masks, gowns, and face shields, must be used in accordance with safety protocols. Identify and describe 3 biosecurity measures veterinary clinics should implement to prevent the spread of infectious diseases. Answer: biosecurity measures are crucial in maintaining a safe environment in veterinary clinics and preventing the spread of infectious diseases, both within the clinic and to the surrounding community. Veterinary technicians play an integral role in ensuring these measures are followed. 3 key biosecurity measures. Isolation areas. Establish designated areas for handling animals suspected of carrying infectious diseases. These areas should be separate from healthy animals, with clearly marked signage to prevent accidental contact. Importance: prevents cross-contamination between healthy and potentially infectious animals, minimizing the risk of disease transmission within the clinic. Disinfection protocols. Regular cleaning and disinfection of high-touch surfaces, examination rooms, and equipment. USEP-approved disinfectants that are effective against a wide range of pathogens, including viruses, bacteria, and fungi. Importance: disinfection reduces the risk of contamination and ensures that pathogens are not transmitted to other animals or staff members. Client education. Educate clients about infection prevention measures, including proper hygiene isolation procedures for sick pets and vaccination protocols. Importance: clients are often unaware of the risks associated with zoonotic diseases, and educating them ensures they are part of the clinic's biosecurity plan. Discuss the role of veterinary technicians in ensuring compliance with animal welfare laws during the provision of veterinary services. What actions must they take to comply with the Animal Welfare Act (WAP) and other relevant regulations? Answer: veterinary technicians play a crucial role in ensuring compliance with the Animal Welfare Act (WAP) by adhering to guidelines designed to ensure humane treatment, adequate care, and proper handling of animals in veterinary practices. They are responsible for maintaining animals in conditions that meet specific welfare standards, including appropriate housing, sanitation, nutrition, and veterinary care. A veterinary technician ensures the proper handling of animals to prevent distress or injury, including during procedures such as surgeries or routine exams. They must monitor the animals post-treatment, ensuring they are free from pain, infection, or other adverse conditions. Record keeping is another essential responsibility where technicians maintain accurate logs of treatments, medications, and surgical procedures. Technicians should report any signs of neglect or abuse, ensuring that any violations of animal welfare laws, such as mistreatment or inadequate care, are promptly addressed. By performing these tasks, veterinary technicians uphold the legal and ethical responsibilities of animal care and safeguard their veterinary practices' compliance with the AWA and other relevant state or federal regulations. Violating these standards could result in penalties or loss of licensure. How can veterinary technicians contribute to preventing the spread of zoonotic diseases in a veterinary clinic, especially with regard to common zoonotic pathogens like Salmonella, Toxoplasmosis, and Leptospirosis? Answer: veterinary technicians are integral in preventing the transmission of zoonotic diseases, which are infectious diseases that can spread from animals to humans. To prevent the spread of Salmonella, technicians ensure that proper sanitation protocols are followed when handling animals, particularly those with gastrointestinal issues. Regular disinfection of surfaces is also critical in reducing the spread of the pathogen. For toxoplasmosis, technicians educate pet owners, especially pregnant women, to avoid handling litter boxes. They may also recommend regular deworming and proper hygiene practices to reduce the risk of transmission. In the case of leptospirosis, technicians must be vigilant when dealing with animals exposed to contaminated water sources. Furthermore, veterinary technicians may play a role in administering vaccines for certain zoonotic diseases, helping reduce the risks of infection in animals and their human handlers. In addition to direct clinical care, technicians also educate pet owners about hygiene practices such as washing hands after handling pets or cleaning up waste. These proactive steps help reduce the potential for zoonotic diseases to spread in the veterinary clinic and between animals and their owners. A veterinary technician is tasked with preparing a dog for long-distance transport by air. Discuss the considerations and regulatory requirements that must be met to ensure the safe and humane transport of the animal, including the specific documentation needed for travel. Answer: when preparing a dog for air transport, veterinary technicians must adhere to various regulations to ensure the animal's safety and well-being throughout the journey. First, the dog must undergo a health examination to confirm that it is fit for travel. A health certificate is required for transport, signed by a licensed veterinarian, verifying that the animal is free of contagious diseases and up to date on vaccinations, including rabies. This certificate is typically required by airlines and destination countries. The technician ensures the dog is housed in an ALT-approved crate, which should be large enough for the animal to stand, turn, and lie down comfortably. The crate must have proper ventilation, food and water containers, and a secure door. If the animal is traveling to a foreign country, the technician verifies compliance with import regulations, such as required parasite treatments or vaccinations specific to the destination. The technician also ensures that the crate is properly labeled with the dog's identification, destination information, and any specific care instructions. Prior to departure, the technician confirms that all required documentation is complete, including the health certificate, proof of vaccinations, and any import-export permits. What biosecurity protocols should be implemented in a veterinary clinic to reduce the risk of cross-contamination between animals with infectious diseases and other animals or staff members? Answer: biosecurity protocols in veterinary clinics are essential for reducing the risk of cross-contamination and ensuring a safe and hygienic environment for both animals and staff. One of the primary measures is the isolation of animals showing signs of infectious diseases, especially highly contagious pathogens such as parvovirus or kennel cough. Veterinary technicians should ensure that these animals are placed in separate areas with restricted access to prevent the spread of pathogens. Personal protective equipment, PPE, including gloves, masks, gowns, and boots, should be worn when handling infected animals or cleaning contaminated areas. Hand hygiene is critical, and technicians must wash hands thoroughly before and after interacting with animals or contaminated surfaces. They should also implement regular cleaning and disinfection protocols for examination tables, cages, and any other equipment used during treatment. Using EPA-approved disinfectants and following the manufacturer's guidelines ensures that pathogens are effectively eradicated. Technicians must also educate clients on proper hygiene practices, such as using hand sanitizers after handling animals to prevent zoonotic transmission. Ventilation systems should be checked to ensure proper air exchange, as pathogens can linger in the environment. What are the consequences of improper handling and storage of blood samples, and how can pre-analytical errors be minimized? Answer: improper handling and storage of blood samples can result in hemolysis, contamination, clotting in anticoagulated samples, or degradation of analytes. These errors can skew diagnostic results, leading to misdiagnosis or incorrect treatment plans. To minimize pre-analytical errors, use appropriate anticoagulants. Ensure correct tubes are used. GE, DTA for hematology, heparin for plasma biochemistry. Maintain proper temperature. Store blood at 2-8 days if analysis will be delayed, but avoid freezing whole blood as it damages cells. Prevent hemolysis. Avoid excessive suction during venipuncture and use needles of appropriate gauge. Mix gently. Do not shake samples, as this can cause cellular damage. Label immediately. Properly label all samples to prevent identification errors. Guidelines such as those from the American Society for Clinical Pathology emphasize strict adherence to these protocols to ensure reliability of results. Explain the difference between macronutrients and micronutrients in animal diets and provide examples of how deficiencies can affect health. Answer: macronutrients are required in large quantities and provide energy or structural components. They include proteins, essential for tissue repair and growth. Deficiency can lead to muscle wasting and poor wound healing. Fats provide energy and essential fatty acids. Deficiency may cause dull coat, skin issues, and reduced immunity. Carbohydrates, primary energy source. Insufficient intake can result in lethargy. Micronutrients are required in small quantities but are crucial for metabolic functions. They include vitamins, e.g. vitamin D deficiency causes rickets in young animals. Minerals, e.g. calcium deficiency leads to hypocalcemia and potential skeletal deformities. Proper formulation ensures balance and prevents diet-related illnesses. Guidelines from the National Research Council (NRC) should be followed for species-specific nutritional needs. Ms. Thompson brings her 7-year-old diabetic Labrador Retriever Max to your clinic. She reports that Max is lethargic and has been losing weight despite eating well. What dietary modifications would you recommend and why? Answer: Max's symptoms indicate poor glycemic control, common in diabetic animals. Dietary recommendations include high-fiber diet, slows glucose absorption and stabilizes blood sugar levels. Low simple carbohydrates, reduces blood sugar spikes. Consistent feeding schedule. Align meals with insulin administration for optimal control. Protein moderation preserves muscle mass while preventing overburdening the kidneys. It's crucial to monitor Max's response to the new diet with regular glucose curve tests. The American Animal Hospital Association (AHA) provides guidelines on nutritional management for diabetic animals. Describe the process and considerations for tube feeding in an anorexic feline patient. Answer: tube feeding is employed when oral intake is insufficient. Steps and considerations include type of tube, nasosophageal esophagostomy, or gastrostomy based on duration and patient condition. Preparation, confirm tube placement via radiograph to avoid complications like aspiration. Feeding schedule, start with small frequent meals to allow the GI tract to adapt. Formula choice, use veterinary prescribed liquid diets that meet caloric and nutritional needs. Monitoring, observe for vomiting, diarrhea, or tube dislodgement. Complications such as aspiration pneumonia underscore the need for meticulous technique, and post-procedure monitoring is outlined in AVMA nutrition guidelines. How does the implementation of a quality control (QC) program improve the reliability of diagnostic test results? Answer: QC programs ensure accuracy and precision in laboratory testing by calibration of equipment, verifies measurement accuracy using known standards, routine checks, identifies deviations from expected results, allowing timely corrections, controls samples, run alongside patient samples to verify assay reliability, training protocols, reduces operator variability. QC is mandated by organizations such as the Clinical Laboratory Standards Institute (CLSI), which outlines best practices for veterinary laboratories. A centrifuge starts making unusual noises during operation. What steps should you take, and why is maintenance crucial for diagnostic accuracy? Answer: unusual noises from a centrifuge typically indicate mechanical issues such as an imbalance or malfunctioning parts. To avoid sample damage and ensure diagnostic accuracy, follow these steps. Stop the centrifuge immediately to prevent further damage or injury. Continuing to use the centrifuge can cause mechanical failure or further imbalance. Check the rudder for any visible signs of wear, cracks, or contamination. Clean the rudder and surrounding areas if needed. Balance the samples. Ensure that the test tubes are balanced properly in the rudder. Imbalance can cause vibration, which may affect sample separation and cause inaccurate results. Inspect the machine. Look for issues with the motor, belts, or any parts that could cause the noise. If these are beyond basic cleaning or adjustment, professional servicing should be scheduled. Regular maintenance, such as calibration and part replacement, is vital to ensure that equipment functions properly as outlined by the manufacturer's maintenance guidelines. Well-maintained equipment ensures accurate diagnostic results and prolongs the lifespan of expensive lab machinery. Why is taurine essential in feline diets, and what are the consequences of deficiency? Answer: taurine is an essential amino acid for cats because they cannot synthesize it in sufficient amounts. It plays a crucial role in several physiological processes. Cardiovascular health. Taurine is required for maintaining proper heart function. A deficiency can lead to dilated cardiomyopathy, DCM, a potentially fatal heart condition. Vision. Taurine is critical for retinal health, and its absence can cause retinal degeneration, leading to blindness. Reproduction. Taurine supports normal fetal development. In pregnant or lactating queens, deficiency can result in poor reproductive outcomes, including fetal resorption or stunted growth. The American Association of Feed Control Officials (OFCO) ensures that commercial feline diets meet the minimum taurine requirements. Deficiency is rare in cats fed balanced commercial diets, but supplementation may be necessary if taurine is not included in homemade diets or if animals have certain medical conditions. What are the risks associated with force feeding, and how can these risks be mitigated? Answer: force feeding carries several risks, including aspiration pneumonia. If food enters the lungs rather than the stomach, it can lead to aspiration pneumonia, a serious condition. To prevent this, ensure the patient is properly positioned and use a soft syringe or feeding tube to administer food slowly. Stress. Force feeding can cause significant stress to the animal. This can be mitigated by using a calm and gentle approach, possibly with sedation if necessary. Gastric rupture. Feeding too quickly or too much can cause gastric distension and rupture. Slow, controlled feeding is essential to prevent this. Mitigation strategies include employing proper feeding techniques, using the right equipment, and monitoring for signs of discomfort or distress during the process. Regular checks of the feeding tube for blockages or dislodgement are also necessary. What are the key differences between acute and chronic renal failure in dogs, and how is the management approach different for each? Answer: acute renal failure, often chronic renal failure (ERF). Both involve kidney dysfunction but differ in cause, onset, and management. Acute renal failure, rapid onset, often caused by toxins, infections, or dehydration. Symptoms can include vomiting, diarrhea, and oliguria, reduced urine output. Management focuses on identifying and treating the underlying cause, e.g., fluid therapy for dehydration or antibiotics for infection. Chronic renal failure, gradual onset, usually associated with aging or long-term kidney disease. Symptoms may include weight loss, polyuria, increased urination, and polydipsia, increased thirst. Management involves dietary modifications, low-protein, phosphorus-restricted diets, and medications to manage symptoms, e.g., antihypertensives for high blood pressure. Both conditions require ongoing monitoring of kidney function through blood work with different strategies for managing fluid balance, electrolytes, and toxin buildup. American Veterinary Medical Association (EVMA) guidelines emphasize individualized care based on the type and stage of renal failure. Discuss the potential complications and interventions for a dog with a recent orthopedic surgery. Answer: orthopedic surgery in dogs, while often necessary for recovery from fractures or joint diseases, carries potential complications such as infection, poor wound healing, and delayed recovery. Infection. Signs of infection include redness, swelling, or discharge at the incision site. To reduce the risk, use sterile techniques during surgery and provide appropriate antibiotics post-surgery. Poor healing. Factors like poor blood circulation or underlying health conditions, e.g., diabetes, can impede healing. Monitoring the wound and ensuring the dog doesn't stress the area is essential. Delayed recovery. Physical rehabilitation, including range of motion exercises and controlled walking, may be required to restore full function and strength. Interventions include pain management, restricting activity to prevent stress on the surgical site, and providing a safe, quiet recovery environment. Working closely with a veterinarian to assess progress is key to successful healing. Explain the main principles of triage in an emergency veterinary setting. How would you categorize a patient presenting with severe dyspnea and cyanosis? Answer: Triage in veterinary medicine is the process of rapidly assessing and prioritizing patients based on the severity of their conditions. The goal is to ensure that those who require immediate care are treated first. Triage typically follows a structured approach where patients are categorized into different levels based on their clinical signs and urgency for treatment. The key principles of triage include initial assessment, evaluate vital signs, heart rate, respiratory rate, mucous membrane color, temperature, categorization, divide patients into categories such as critical, urgent, or non-urgent based on their clinical condition, stabilization, immediate intervention for critical patients to ensure survival. A patient presenting with severe dyspnea, difficulty breathing, and cyanosis, bluish mucous membranes, would be categorized as critical level 1, requiring immediate attention. The cyanosis indicates that the animal is not getting enough oxygen, and the dyspnea suggests respiratory distress. Immediate interventions, such as oxygen therapy, stabilization of the airway, and rapid IV access for fluids or medications, should be performed. In veterinary CPR, what are the key differences between basic life support (BLS) and advanced life support (ALS)? Include protocols for both. Answer: veterinary basic life support (BLS) and advanced life support (ALS) are two phases of CPR, each designed to provide life-saving interventions but differing in the level of complexity and equipment used. Basic life support (BLS) involves fundamental measures to stabilize the patient. Recognition of cardiac arrest. This involves identifying the signs of cardiac arrest, such as lack of pulse and unresponsiveness. Chest compressions. For small animals, compressions should be performed at 1:0:0:12 euro per minute with a depth of 1:3 to 1:2 of the chest width. For larger animals, it should be done at a rate of 8:0:1:0 compressions per minute. Ventilation. If an airway is secured, ventilation should be performed at a rate of 10 breaths per minute. The goal is to ensure oxygenation while compressions are being performed. Advanced life support (ALS) builds upon BLS by adding more advanced techniques. Medication administration. Epinephrine is given at a dose of 0.1 mg IV every 3-5 minutes to stimulate the heart. Vasopressin may be used as an alternative. Defibrillation. If ventricular fibrillation is present, defibrillation is indicated. In most cases, a defibrillator can be used to administer shock and restore normal rhythm. Monitoring. ALS involves continuous monitoring with tools such as an ECG and end-tidal co, allowing adjustments to the resuscitation efforts. According to the RACOVE, our initiative, ALS improves survival rates when administered after BLS, especially in cases of traumatic or cardiac arrest. The inclusion of medications, defibrillation, and continuous monitoring provides a comprehensive approach to maximizing the chances of survival. Describe the proper handling and restraint techniques for a MACO during a veterinary examination. Answer: proper handling and restraint of a MACO are critical to prevent injury to the bird and ensure a smooth examination. Due to their size, strength, and potential for stress, MACOs require specialized techniques. Approach. When approaching a MACO, ensure that the environment is calm to prevent stress. Avoid sudden movements and loud noises. Use a towel to gently cover the bird's wings and head to reduce flight risk and anxiety. The towel should be held firmly but without excessive pressure to keep the bird calm. Restraint. Secure the bird by gently holding the neck and body. Place one hand around the bird's neck, applying slight pressure to prevent it from turning its head, which could be a source of stress. The other hand should be used to support the body, ensuring that the wings are secure against the bird's sides. Be cautious not to apply pressure to the chest, which could impair breathing. Additional considerations. If the MACO is highly stressed, it's essential to limit handling time. Offering a safe, quiet space is crucial for recovery. A soft perch should be available for the bird's comfort during the exam. Dr. Alvarez is presented with an 8-year-old golden retriever, Max, in anaphylactic shock after bee sting. Max is dyspneic, hypotensive, and has pale mucous membranes. What emergency drug administration steps should Dr. Alvarez take to stabilize Max? Answer: Max's presentation of dyspnea, hypotension, and pale mucous membranes suggests anaphylactic shock, which requires immediate emergency intervention. Dr. Alvarez should follow these steps. Epinephrine administration. The first-line treatment for anaphylaxis is epinephrine 0.1 mg intramuscularly, as it rapidly counteracts the effects of histamine release, including vasodilation and airway constriction. If the response is insufficient, a second dose can be administered 15 minutes later. Fluid resuscitation. Given Max's hypotension, Dr. Alvarez should administer IV fluids, crystalloid fluids, G. Lactated Ringer's solution should be given at a shock dose of night AR initially, then adjusted based on Max's response. Oxygen therapy. Administer oxygen via face mask or nasal cannula to support Max's respiratory function, especially due to the dyspnea. Antihistamines. Diphenhydramine 1, e.g., should be administered intramuscularly or intravenously to block histamine receptors and reduce the inflammatory response. Corticosteroids. Dexamethasone 0.1, 0.2 indicated to help control the inflammatory reaction. Explain the environmental and dietary requirements for captive leopard geckos. What are the consequences of neglecting these needs? Answer. Leopard geckos, being desert-dwelling reptiles, have specific environmental and dietary needs that must be met for their health and well-being. Temperature gradient. Leopard geckos require temperature gradient in their enclosure. The warm side of the enclosure should be maintained at 90-95 degrees to allow for thermoregulation, while the cooler side should stay around 75 degrees. The basking spot should be provided at 95 degrees to allow the gecko to regulate its body temperature, lighting, and humidity. Unlike some reptiles, leopard geckos do not require UVB lighting, but they do need a day-night cycle. The humidity level should be around 30-40% to prevent shedding issues. A moist hide is essential to help them shed properly at diet. Leopard geckos are insectivores and require a diet rich in live insects such as crickets, mealworms, and dubia roaches. These insects should be dusted with calcium powder to prevent metabolic bone disease (MED), a common condition in reptiles due to calcium deficiencies. Substrate. Use non-ingestible substrates like reptile carpet or paper towels to prevent impaction from ingestion of loose substrates. Consequences of neglect. Neglecting the environmental needs of leopard geckos can lead to a variety of health issues. Inadequate calcium intake, for example, can result in MBD characterized by soft bones, lethargy, and fractures. Improper humidity and temperature can lead to shedding problems, including retained skin and infections. ARAV guidelines stress the importance of maintaining proper husbandry to prevent such issues. What is the process for placing an intravenous Roman catheter in a critically ill dog? Include potential complications and mitigation strategies. Answer. Placing an intravenous Roman catheter in a critically ill dog involves several steps to ensure effective fluid therapy and drug administration. Preparation. Select a suitable vein. The cephalic vein is commonly used for dogs, though the saphenous vein may also be an option. Sterilization. Shave the area clean with an antiseptic solution, e.g. chlorhexidine, and wear sterile gloves. Positioning. The dog should be placed in a comfortable position and the limb should be extended to increase vein visibility. Insertion. Use a sterile catheter of appropriate size, 2.22 gauge for most dogs. Insert the needle at a 1.530 angle into the vein and advance the catheter through the needle. After securing the catheter in place, remove the needle and flush the catheter with saline to ensure patency. Securing the catheter. Secure the catheter with adhesive tape and cover with a sterile bandage to prevent displacement, complications, infiltration, extravasation. Fluid may leak into surrounding tissue, leading to swelling or pain. Mitigation involves monitoring the catheter site regularly. Thrombosis, blood clot formation in the catheter or vein can obstruct flow. Regular flushing of the catheter with saline helps prevent this. Infection. Proper aseptic technique and monitoring for signs of infection such as redness or swelling are crucial to prevent complications. What is the role of a veterinary technician during a major surgery, and how does the technician contribute to anesthesia monitoring? Answer. During a major surgery, a veterinary technician plays a critical role in supporting the surgical team and ensuring the animal's safety. Specific responsibilities include preoperative preparation, preparing the patient by ensuring that the animal is properly fasted, administering preoperative medications, e.g. antibiotics or sedatives, and performing any necessary blood work. Anesthesia monitoring. The technician is responsible for monitoring the animal's vital signs under anesthesia, including heart rate, respiratory rate, temperature, blood pressure, and oxygen saturation. The technician uses monitors such as ECG, pulse oximeter, and capnograph to assess the animal's condition continuously, assisting with equipment. The technician sets up and ensures proper functioning of the anesthesia machine, endotracheal tube, and intravenous lines. The technician is also responsible for administering anesthetic drugs as prescribed and adjusting them based on the animal's condition during surgery. Post-operative care. After surgery, the technician is involved in monitoring recovery, ensuring that the patient is awake, pain management is adequate, and the animal is stable before being transferred to recovery. What is a differential diagnosis and how would you approach it in a case of sudden, severe vomiting in a cat? Answer: a differential diagnosis is the process of systematically narrowing down a list of potential causes for a patient's clinical signs based on clinical presentation, history, physical exam findings, and diagnostic tests. For a cat presenting with sudden severe vomiting, the approach would include history taking, assess the cat's diet, any recent changes, exposure to toxins or new substances, access to plants or chemicals, and prior health history. Physical examination, perform a thorough physical exam, checking for signs of dehydration, abdominal tenderness, or pain, and assessing overall body condition. Differential diagnosis, gastrointestinal causes, foreign body ingestion, gastrointestinal obstruction, gastric ulcers, or inflammatory bowel disease. Infectious causes, parvovirus, feline panleukopenia, or bacterial infections, toxins, certain plants, foods, or chemicals that may induce vomiting. Systemic diseases, renal or hepatic failure, pancreatitis, or hypothyroidism. Diagnostic testing, blood work, CBC, chemistry, radiograph, or ultrasound, and fecal tests to identify specific diseases or conditions. Explain the potential complications of pyometra in a dog and the role of the veterinary technician in managing these complications. Answer: pyometra is a potentially life-threatening infection of the uterus commonly seen in intact female dogs. Usually occurring after estrus, it can lead to severe complications such as sepsis. The infection can spread to the bloodstream, causing systemic inflammatory response syndrome, SIRS, or septic shock, renal failure. Due to toxin release and dehydration, pyometra can result in kidney damage and dysfunction, uterine rupture. The infected uterus can rupture, leading to peritonitis, a life-threatening condition, hemorrhage. The infection can cause uterine bleeding, leading to hypovolemic shock. Veterinary technician's role: monitoring vital signs. Close monitoring of temperature, heart rate, respiratory rate, and blood pressure is crucial, as septic shock and renal failure can affect these parameters. Fluid therapy. IV fluids are essential to support circulation, restore blood pressure, and manage dehydration. Antibiotics. Administering broad-spectrum antibiotics to control the infection as prescribed by the veterinarian. Post-surgical care. After spaying, the treatment of choice, the technician monitors the animal's recovery from anesthesia, pain management, and wound care. Describe the common types of anesthesia used in veterinary medicine, their indications, and potential side effects in a geriatric dog. Answer: in veterinary medicine, anesthesia is essential for safe and effective surgeries or procedures. Common types include inhalant anesthesia. Isoflurane and sevoflurane are commonly used. These agents are inhaled and provide rapid induction and recovery. They are ideal for maintaining anesthesia during surgery and have minimal side effects. Indications: used for long surgeries or for procedures requiring deep anesthesia. Side effects: can cause respiratory depression, hypotension, and arrhythmias, especially in geriatric dogs with compromised organ function. Injectable anesthesia. Propofol is commonly used for induction and short surgeries. It allows rapid induction, but the animal may need additional drugs for longer procedures. Indications: ideal for brief procedures or as a premedication for inhalant anesthesia. Side effects: potential for respiratory depression and hypotension. In geriatric dogs, propofol should be used with caution due to its effects on the liver and kidneys. Local anesthesia. Local anesthetics like lidocaine are used for minor procedures, e.g. wound repair, or to provide localized pain relief. Indications: used for minor surgeries or to supplement general anesthesia. Side effects: rare but can cause localized reactions such as swelling or irritation. Care should be taken to prevent systemic toxicity. Geriatric dogs are more sensitive to anesthesia. Special considerations include monitoring organ function, adjusting dosages, and providing proper preventive care, such as blood work and IV fluids. The veterinary technician's role includes assisting with anesthesia administration, monitoring the patient during surgery, and aiding in post-operative recovery.